when we're going to do the lateral glide of the tibia, we were placing the towel roll on, okay, and then we were just pushing straight down, okay. The treatment plane is the
Tibia.
what is that straight up and down right now?
No.
How is it?
It's a little bit angled.
It's actually tilted at an angle because the tibia is lower here and higher up here. So if I'm going to do a lateral glide, I either have to change that angle of force, but what I've been showing people to do, and I think is better ideally, is to support the leg, de-rotate the hip, get the tibia, so now it's parallel to the ground. The treatment plane is now straight down, and now you can go ahead and much easier do your lateral glide. The same thing is true even when you're doing the relative medial glide. If I just let go, the leg can be in rotation, and so even for the femur here, it would not be good, or some people were just pushing and they were just getting a lot of rotation through the leg. But if you just support the lower portion of the ankle with your one hand, then you're going to be able to do the relative medial glide with the opposite hand, okay? And you're going to be more precise and get a better. So I saw it from a few places, so I definitely wanted to bring it up in the circle discussion there.
So are you trying to palpate it all with that?
Not so much actually when I'm doing my mobilizations, because there's a lot of force output. You do as much as you possibly can. The answer is yes. I mean, do I feel how much and how firm I'm pressing? Do I feel the end range of the movement and me going? Yes, I feel like I feel that. Okay, but do I have that specific palpating finger? In a lot of these cases, it's not going to be happening. But I mean, in a lot of them there are. Can you lay on your back for me? When I'm doing just a plain posterior glide, and I've got them up here, I'm forcing through here, but I've got my fingers here that are right on the joint plane, and I should be able to sense how much it's flattened. But because the table's doing a pretty good job of stabilizing her femur for me, I have my other hand, and I can use my other hand here. So in this case, yes, I can use my opposite fingers as a palpating finger and kind of get an assessment for how much it's moving and that it's at the end range. So there's lots of instances, and whenever possible, you always want to, but sometimes this setup just doesn't allow for a lot of it. Okay. So that was that. One thing I didn't show you was we showed you the prone technique for the anterior glide. You can do a posterior glide of the tibia in prone, if you just lay on your stomach for me. Generally, I have the person lay all the way at the edge of the table, okay? And then what you end up doing is the person's tibia, and this is definitely for people who can achieve at least 90 degrees or very close to 90 degrees and maybe then some. Again, you always have to be cognizantly aware of where in the range of motion you are with your tibia, okay? But you just kind of support the lower end of the tibia on your shoulder at 90 degrees, exactly 90 degrees, my treatment plane straight forward. So now I can impart the posterior glide. Her femur is being stabilized by the compression. So the first part is I'm taking up all the slack in her femur, and now it's stabilized, and then I'm going into the mobilization, okay? So you can do that way there, okay?
Kind of hard on your body mechanics, though.
That's terrible, but I have high-low tables in my clinic. So. This is actually a really great one when you really need a lot of force and you're looking for a lot of force. This is actually one of the easier ones where I can. But as I'm taking them up higher and higher, I start to think about, well, it's not straight down anymore. It's actually slightly inferiorly, so I have to start moving in those directions when I'm getting to that point. Okay. Flip over on your.
Would you start
Sit up
the
for me.
patient down in that one?
You could, I don't, because I feel like their body stabilizes the femur for me, so I don't
I didn't know if
do
they
it.
would start like sliding or anything.
Well, hopefully I'm not pushing so hard that I shouldn't be able to physically slide her whole body up, I don't. So from this position, you can easily do, posterior glides are very easy. And somebody get me let me have that belt right there, that's fine. I prefer a mobilization belt to keep that's working. Okay, so
There's a mobilization belt.
posterior glides, okay. Anterior glides can be done. Again, you're pulling, whenever you're pulling, it's not ideal, but it's possible. This is one where you may want to stabilize the femur down, but again, to me, if I'm doing a posterior glide, yes, she's going to get some movement at first, but then it's going to lock up all that movement. The femur is stabilized, and now I can do the posterior glide of the tibia. I can change the amount of degrees of flexion they're in, or extension. This is way too small. why I like my mobilization belts better. But if I want to do a posterior glide and just in this position, I could be in this position and do a posterior glide. This is way too short. Get one of the get the mobilization belt. Yeah, let me have that instead. So you can start to support the actual limb itself using these belts. Status post knee replacements, you're still having a hard time getting to 90 degrees. Not only does this allow me to regulate how much flexion they have when because I can let go of them if I need more extension there, but what that also allows them to do is they relax their leg. It gives me 2 hands free now to perform some of these posterior glides, and as opposed to trying to hold this one up and push with the other one at the same time. I have both hands free because the leg's not just hanging anymore. I need her up and a little bit more degrees of extension. I showed another person how to use the belt. They were having a hard time kind of with the anterior glide, holding the limb up and then doing the glide at the same time, while using the belt to support the majority of the weight of that lower leg. So then, yes, she still had her hand in the correct position. It was on the angle to stabilize, but she wasn't doing nearly as much work in her non-mobilizing hand that it was much easier for her to go through the mobilization with the other hand. Distraction in this position is a real good one too. Scoot back a little bit for me. Where's that little towel thing I just had a second ago? You guys got that there a second? Okay. One thing you do with these treatment tables, the patient's femur tends to be at a downward angle, okay? So sometimes even before with what I was just showing you, it's not a bad idea to get a little towel roll. Helps to level out the femur and become more, you might need to bolster it up a little bit more, but that's the first thing. I can work hard in this position and just, now that the femur is stabilized against the treatment table, I can work really hard and just do a distraction here. I could, or I can make life easier on me and you can use these belts. I'm going to be honest with you, this is not the best technique for me because I actually have a physical strap that is designed to do this. I don't have to make it up with my mobilization belt, but what you can do is now use your foot as your mobilization technique, okay? So I'm going to have to bring this up a little bit higher. And then actually the one group up in the corner there, they were doing a really good job. They had this down, and this is something Nada uses in her clinic because she doesn't have the attachment like I have that I use. Go ahead, yeah. Okay, yeah, so just wrap it once and pull it down. So there's a lot of good. There's a lot of good that comes out of this. One, I don't have to work nearly as hard, though it looks like I'm working pretty hard at the moment just to get this fit up. Right? So I get her in the right position, and now I can physically start to perform that mobilization. But the other thing I can start to do is I can get myself up from the table. If I need her in more extension to do this, I can distract her leg using just the weight of my leg, okay, and more extension. Or flexion, if the table allows me, I can get her into further degrees of flexion and then push, okay? This is not ideally set up at the moment. Again, I don't ever have to set this up because when I use it, I have it is one of those, those pads that are on these guys? It's one of those with Velcro, so I wrap it around the ankle. I just Velcro it down so it's wrapped nice and tight here. And then it's got just a little tiny loop that I can actually adjust the length of. And I just put my foot on it and I'm good to go. I mean, it's so simple. This thing's a lot more a little bit more complicated trying to set it up. But you get the general gist of the idea, okay? The one thing I didn't see you guys do a lot of is exercises, so you're going to have to work on those quite a bit because a lot of the times when we do reap-ins, we ask you guys about exercises and what you would do for these impairments. For right now, let's take a break. Let's all be back.